We'd like to welcome our next guest on the program. Bringing on is Eric Grossman, CEO of NextHealth Technologies. Eric, good morning and welcome.
Good morning. Thanks for having us. Honored to be here.
Yeah, nice to have you on, Eric, and good to talk to you again. Give our audience a little background, not only on yourself, but what on NextHealth Technologies, please.
Great. Good morning. It's Eric Grossman. I'm the CEO of NextHealth Technologies. By way of brief background, prior to founding NextHealth, I led corporate strategy at TriZetto, and then prior to that, I was the CEO and founder of Connecture, a sales automation vendor in the health insurance sector. And as far as NextHealth, we're a big data analytics platform company helping and driving consumers to make better healthcare choices. We've been around 2.5 years, and we're moving the needle on outcomes in the market.
Yeah, tell us how you're doing that, Eric. Tell us your model and how you're doing that, because I mean, there's a lot of companies out there saying they specialize in analytics or population health or consumer engagement. So tell us your unique footprint and how you're getting that done.
Great. Yeah, it's definitely a lot of rare air in terms of being able to move the needle on consumer engagement. We've been able to do it in lower income populations, specifically the Medicaid market, where we've taken 1 in 4 people out of the emergency room who otherwise shouldn't have been there. And that translates into some pretty significant claim savings in the market. And for these folks, we're doing really 3 big things, all with big data and analytics at the heart of what we do. The first thing is it's better targeting. We're finding folks who shouldn't be there in the first place and are also impactable for things like stomach aches and sunburn for mothers with children who are going after 5 because they can't get an appointment and they're not aware of alternative care settings. The second thing we're doing is actually reaching out to them with personalized nudges. And a nudge is a behavioral economic frame where we're serving up lower cost alternatives, like, for example, nurse advice lines, urgent care centers, flu shots, just ways of getting them into the healthcare ecosystem so they're educated on alternatives to the ER. And then third, probably the most important thing we're doing is we find out what's working for whom, and we amplify that, and we turn off the things that are not. We use what's called a randomized control trial to do that, and the result of those 3 things are outcomes, and that's a pretty, like I said, a pretty rare air in the market right now.
So Eric, kind of simplify it for myself and the audience is that, what you're alluding to is that we consumers, the large sector, have this habit of thinking the emergency room is the only option, correct?
Correct.
So you're bringing to we, the consumer, the alternatives that can allow us to make a better decision for ourselves and our family. Am I understanding that correctly?
To the right consumer. If you can only make 1 call and you have 10 people to choose from, who do you make that call to in a resource-constrained environment? And the billboards are all out there, right? No wait time. But the reality is that's to see the receptionist. That's not to see a doctor. And on average, it's about $1,000 versus about $100 if you go to your PCP for a stomach ache. And you don't even have to go to your PCP. There's telemedicine. There's nurse advice line. We all have a part to play in lowering healthcare costs.
So talk a little bit about, because a lot's talked about in this space too, about behavioral economics, and talk about how that applies to your model, if you would.
Yeah, for the most part, there are a lot of predictive analytics companies who send a list into a health plan of high-risk members. Well, there's a lot of wood to cut between a list of high-risk members and a behavior change. And what we find, and borrowed from other industries, is that behavioral economics, which are basically carefully crafted words personalized to the member, make a difference. And, for example, we all get our energy reports in Colorado. It's Excel Energy. They compare us. Compare Eric Grossman's use to my neighbors and say how energy efficient I am, and here's steps to take. That's called a social frame. And when you compare people to you, it's powerful. And we use that same type of behavioral economics to nudge a mother to get her kid's flu shot. And it just so happens that mother has children who are super utilizers in the ER, but by nudging them to get a flu shot, we're getting her into the healthcare ecosystem at a lower cost to the market.
Yeah, that makes a lot of sense. What is your current business model, Eric?
Sure, great question. We're very different than most because we put a significant portion, almost all of our profit, into percentage of savings. So we put our fees at risk, and they're aligned around our health plans or at-risk hospitals to make sure if we're successful, they're successful, and vice versa. We're not just selling an implementation or a software fee.
Mm-hmm. So who's your primary? So you're looking to integrate and with health plans and hospital systems. Is that what's your current distribution channels right now?
Right. We primarily target almost 100% any risk-bearing entity.
Okay, got it.
That's typically a health plan or an integrated delivery and financing system hospital that owns a health plan.
Mm-hmm. So how about the employer market? Because their hair's on fire right now to look for alternatives to, help them bend the cost curve. Majority of them are self-funded out there,
sure.
Help the cost curve, but also to provide better tools, health literacy and better decision tools to their employees and their families, the consumers. So talk about the employer market a little bit.
Right. I mean, as you know, 300 million Americans, it breaks down into a lot of different lines of business. And as a relatively early stage company, there's only so many markets we can pursue.
Sure.
But the employer market is a market that we're servicing through our Blues customers and national accounts that have what's called administrative services accounts. So we have a very large group of retail chains that we're currently servicing and being able to make a significant impact specifically on emergency room use of their employees around the U.S. So we're all feeling the pain. The employer market has a special advantage. They have all the email addresses of their employees and all the telephone numbers. So it's a great market for us that we're very open to pursuing. And also they have a longitudinal history of their member. That's a little bit different when you go into a hospital where they only have the claim if you went to their facility. So an employer and a health plan have very strong data sets that are available to a company like NextHealth.
Yeah, I think employers listening to this program or that will listen to future podcasts should consult their health plan about your solution and saying, hey, are you aware of this? Are you using it? Because it makes a lot of sense on the piece of the puzzle that it fits and helps solve as we're trying to not only bend the cost curve but provide better care and alternatives to the consumers out there.
Can we use that as our motto? It makes a lot of sense.
Yeah, you sure
can.
We'll
spell it that way. We'll spell it literally.
You will like that, huh?
CENTS.
Yeah. Eric, talk a little bit about, the ER, but your model can apply to, we have a big problem without a network utilization. Can it apply to that to help, solve that problem?
Yes. Underneath all this is that you have a solution partner that can scale to support other business problems. And given that we have an open source, cost-effective platform, we host it in Azure, and a very extensible data management infrastructure, we've been able to extend the solution to 30-plus other use cases. And at an existing account, we can launch a new clinical program in as little as 10 days. That has to do with a lot of the investment we made in MongoDB and Python. But yes, we're currently solving for out-of-network utilization as well as exchange population risk reduction. And that out-of-network use case is a big problem in the U.S. with ACA plans. A lot of people buy on price, and they don't realize that there's a narrow network. So we educate members on, the cost differential and in-network alternatives that are available to them using that same sort of nudge approach.
So this is touching on, as we kind of move to close this program over the next couple of minutes, I'd like you to really talk about, and this is one of them, some of the challenges you see healthcare executives facing as we move to value-based care and the rise of consumerism. Or value-based care and the rise of consumerism. What are other challenges that you see that the healthcare, market is going to face?
I guess I would leave the market with a challenge, is that orchestrating consumer behavior change is very difficult, and if you try and solve for a capability or a functional implementation, it's a long way off from a behavior change. And where we've had success and we'd advise the market is that solve for a business problem and orchestrate technology around it versus the other way around. I think that's probably the biggest lesson learned in my career, is don't sell capability, sell an outcome.
Yep, that's interesting. Eric, it's been great having you on the program, and I want to allow you a minute or so to kind of recap, this discussion and leave our audience with, a few takeaways, if you would, please.
Sure. My biggest takeaways in the industry is that, we are being compared to Zappos and Amazon and overnight delivery and that frictionless experience. And customers and consumers have access to big data. They know what experience they want, and now they can vote with their wallet. They can move. They can go to different health plans. And our industry has to do a better job about using all their resources effectively to deliver that frictionless experience. And NextHealth is a good example of a company that's been able to do that. We focused on emergency room reduction, and these people are eager to have a seamless experience, and they appreciate it. They appreciate not having to wait in the ER and park and do all that stuff. There are lots of alternatives that are available to them. You just have to target them better, find impactable members, personalize your engagement, and most importantly, you have to be able to measure and amplify those signals, because you only have so many calls you can make in a day. It's entirely achievable. You just got to make the right no-regret investments.
That's great, Eric. And tell our audience how they can connect with you.
Sure. The best way to get in touch with us is go to our website, www.nexthealthtechnologies.com, and we'd love to hear about your challenges and see if it's something we can help with.
Eric, thank you so much. Enjoyed the discussion. Thank you for taking the time. Have a great weekend.
You too. Vote for the Broncos.
There you go. I am pulling for Broncos. There you go. Take care.
Perfect.